A man came to see me, 34 years old, says, I went a month without touching myself or my partner. I wanted to raise my testosterone, read that this was supposed to help. Instead of strength, I got nighttime incontinence and pain in my lower abdomen. That's the right place to start an honest conversation about abstinence, a topic surrounded right now by more emotion and slogans than facts, where both sides of the argument usually tell only the half of the truth that's convenient for their position. Let me say this up front. I don't care whether you practice abstinence or not. This isn't a story about my personal opinion. It's a story about what's documented in medical literature, and I'll try to present both sides honestly rather than just one convenient one. If your own experience differs from what I'm about to say and it's working well for you, keep doing what works. I'm not trying to convince you otherwise. Let's set religious and spiritual traditions around this topic aside right away. Those operate on entirely different goals and logic. This isn't a medical conversation, and comparing it to physiology doesn't make sense. I'm only interested in what's actually happening in the body and what's been clinically confirmed. A very common argument from strict abstinence advocates is, abstain and you'll have high testosterone, high serotonin, high dopamine. It's worth pausing here because before making claims like that, it helps to actually understand how testosterone metabolism works, what it's made from, what it converts into, how it's regulated. Without that basic understanding, the conversation turns into slogans instead of medicine. The second common argument is that abstinence causes congestion. And yes, congestion genuinely does happen, but not in everyone, only in a specific subset of men. And advocates of abstinence almost never mention that detail, even though it's critically important. Here's the first physiological fact worth knowing. Ejaculation happens to you, regardless of your conscious decision. The mechanism just changes. There's a phenomenon called nocturnal emission, involuntary ejaculation during sleep, and sometimes even during intense physical exertion or emotional strain. I had a patient for whom this happened during heavy, deep squats. By the third set, he'd reach orgasm with no sexual stimulation involved at all. This isn't rare or pathological, it's a natural safety valve, and it's especially active in young men and in men with high testosterone levels. A lot of people notice that in their teenage years, around 14 to 18, these episodes happened far more often, precisely because hormone levels and stimulation were higher then. Prostatic fluid has to go somewhere. If it doesn't exit through voluntary release via regular sexual activity, the body partially reabsorbs it and partially tries to push it out through those same involuntary episodes toward the urethra. Now, the key question that abstinence advocates usually avoid: what happens to a young man with hypogonadism, meaning naturally low testosterone? In patients like that, as well as those with subclinical androgen deficiency, nocturnal emissions almost never occur, because hormone and stimulation levels are too low to trigger that protective mechanism. And here's where the real problem starts. If there's no natural release valve, and that person is then told to additionally restrict themselves, prostatic fluid stagnates with no alternative outlet. That's a direct path toward congestive prostatitis. Next, let's talk specifically about who this kind of advice can genuinely harm. If a man has a history of even one episode of acute prostatitis or repeated flare-ups of chronic prostatitis from E. coli or enterococcus getting into the prostate, the gland tissue is already not perfectly healthy. There may be fibrosis, calcifications, pockets of chronic inflammation that no amount of willpower will resolve. What happens with a patient like that during regular sexual activity? Once or twice a week, prostatic fluid exits along with the bacteria it contains, reducing the bacterial load that the body otherwise can't clear on its own. In a patient with chronic prostatitis, prolonged abstinence instead allows that bacterial flora to accumulate and provokes a flare-up. A similar logic applies with benign prostatic hyperplasia, where the actual process of clearing prostatic fluid is already mechanically impaired due to the enlarged gland. Picture a 50-year-old man with a fairly enlarged gland and lowered testosterone. That's not a disease in itself, just a natural part of aging. If he's told to additionally restrict himself in order to raise his testosterone, an already difficult urination process now has a prostatitis flare-up stacked on top of it, and sometimes the outcome is genuinely unpleasant. One morning, that patient simply can't urinate at all. An ambulance has to be called. Best case, a urethral catheter gets placed. Worst case, a tube has to be placed through the abdominal wall because normal urination doesn't recover on its own. And with acute prostatitis present, placing that catheter can be seriously complicated. Sometimes it physically can't be left in. Someone might say, but this doesn't happen to everyone. True, but not every smoker develops lung cancer either. And yet, warning images of damaged lungs still appear on cigarette packs because the risk is real, even if it doesn't materialize in every individual case. That's exactly why these risks need to be discussed openly, not left out for the sake of ideological purity. Now to the most contested question. Does abstinence actually raise testosterone? There's a very old observation. Back when directly measuring testosterone in a lab was difficult, one researcher grew out his beard, periodically trimmed it, and measured hair growth rate as an indirect indicator of hormonal activity. And indeed, beard growth rate was higher during periods of abstinence, an interesting, if indirect, observation. Later, a more specific claim emerged, stating that testosterone rises significantly by day 7 of abstinence. But that study was later officially retracted because on review, there wasn't sufficient evidence to support the claimed effect. That's an important lesson. Not every study cited in these debates holds up under scrutiny, and blindly trusting any number that happens to confirm a convenient viewpoint isn't wise. Meanwhile, data on stress hormones and prolactin show the following. After regular sexual activity, studies don't show testosterone dropping toward the lower bound of normal or spiking toward the upper bound. Prolactin does rise temporarily after ejaculation, but returns to baseline within a few hours, nowhere near the prolonged hormonal depletion some people warn about. And here's the central point that abstinence advocates almost never mention. A significant portion of the studies showing negative effects from masturbation and regular sexual activity actually studied men who were heavy consumers of pornography. Porn dependency is a completely separate variable that distorts the results and gets mixed into these conclusions, creating a false cause and effect link between ejaculation itself and negative effects, when the real driver may actually be excessive pornographic content. It's also worth mentioning the cultural context here. There's essentially no research on this topic conducted on a Russian population specifically. It's all references to foreign studies done within entirely different cultural and medical systems. And if you're an abstinence advocate, you'll find 100 studies supporting it. If you're firmly against it, you'll find the exact same 100 studies against it. That doesn't mean science is lying. It means the question is far more complicated than a one-sided slogan in either direction. It's also interesting to look at examples from sports, since they're often used as arguments by both sides. Muhammad Ali was a committed believer in abstinence and practiced it before major fights for fairly extended periods. By his own account, it brought him real benefits. Cristiano Ronaldo, a hugely successful athlete in a completely different sport, says the opposite. That sex before important games is essentially a mandatory ritual for him. The truth here seems to be individual. If having sex doesn't interfere with your sleep and recovery, and it genuinely helps you specifically, try it. But if you're spending half the night having sex instead of resting, the benefit is questionable regardless of how you handle the rest of your routine. There is an observation that athletes who abstain before major competitions show somewhat better heart rate recovery after exertion and somewhat better tolerance for intense training. That's a concrete, measurable parameter, not just a subjective feeling of strength. Now let's talk about the genuinely harmful extreme practices sometimes recommended under the label of proper abstinence. One approach involves bringing a man almost to orgasm and deliberately preventing ejaculation, repeating this multiple times. This creates overstretching of the seminal vesicles and chronic congestion in the pelvic organs, probably one of the most harmful practices in this entire topic. There's another practice, clamping the urethra at the moment of ejaculation to suppress it, or clamping the perineum, practicing what's called a dry orgasm. The logical flaw here is that ejaculation still happens, it just goes backward toward the bladder instead of outward, a phenomenon called retrograde ejaculation. During a natural orgasm, the sphincter located above the prostate closes to prevent semen from entering the bladder, and when you forcibly clamp everything below it at the moment that sphincter opens, you're forcing the fluid to push through under excessive pressure in the prostatic portion of the urethra. Over time, this can lead to inflammation of the seminal vesicles in some men, sometimes blood appearing in semen, a condition called hemospermia, and a gradual decrease in gland sensitivity. Some men do eventually reach ejaculation this way, but because the act was artificially prolonged, they can later develop their own set of prostate-related issues too. The man who came to me after a month of strict abstinence turned out to belong to exactly that category of patients with a hidden predisposition toward congestive processes in the prostate that he hadn't known about before. After 2 weeks of proper treatment and without further forced abstinence, his condition fully stabilized. To sum this up honestly, without pushing either side, if you don't have benign prostatic hyperplasia, no chronic congestive prostatitis, no significant calcifications, fibrosis, or sclerosis of the gland, and no history of repeated acute prostatitis episodes, you can try abstinence, serious harm is unlikely, and whether to try it is entirely your call. But if even one of those factors is present, or if low testosterone has already been confirmed, abstinence in your specific case can cause real, not theoretical harm. Subscribe. I break down topics like this every week without pushing an agenda in either direction, just clinical experience and what the medical literature actually supports. Link in the description for questions you'd rather not ask out loud anywhere else.